My name is Mohammed Ghniem. I'm an emergency medicine doctor. I've been working, I've completed my studies from Islamic University of Gaza, and I've been working in a Shifa hospital. I've witnessed many conflicts and attacks on Gaza during the last couple of years, and the most difficult one was the one started in October 2023. Part of our training in Gaza as emergency physicians was to receive mass casualty training every couple of months. The last one was done in July 2023, and we have been asked by the instructor as a group discussion to make like the worst case scenario that we might face during this mass casualties. And the worst case scenario was never estimated more than 5 of pediatric trauma. But unfortunately, in the 4th day, this is me, I'm the triaging officer. In the 4th day, maybe 11th of October 2023, I was the triaging officer for mass casualty for pediatrics. There was a couple of kids who are queuing to get clean water in a shelter refugee camp, and they have been attacked at that day. It was my first time to be a triaging officer for a pediatric mass casualty. I used to work with adult mass casualties. It was my first day to deal with these casualties. And it was my first day to be as a triaging officer after being a father for a 1-year-old kid. So the psychological impact on me was absolutely horrible. There was limited staff and supplies, and the infrastructure was overwhelmed from the 4th day of this attacks in Gaza, because we have the displaced civilians who are sitting or living inside the hospital. Al-Shifa Hospital is the biggest trauma center in Palestine, not only in Gaza. And we are like dealing with massive influx of casualties and unpredicted number of casualties. Many children arrived in very different types of injuries, arrived without identification, arriving without any of their family members, and we started, myself started a coding system from the very beginning to make sure that if there is a family member came later, then they will be able to identify. It was a very simple coding system. Just write the date of the arrival of the kid and the estimated time of the arrival. And the family, they will come after a couple of days. If there is a family member left, they will ask, have you received any kind of casualties at that day, at that time? Then we started to improve it time by time, and it was a heartbreaking transformations, because patient became numbers before they had names, unfortunately. This is type of the casualties or the injuries that we dealt with. It's a 4th degree burn, which is I have never seen in my life. Unfortunately, we have to do an amputation for this burn because of the lack of equipment and because of the delay presentation of these injuries. There was extensive shrapnels and wounds around the face, and as you can see in the previous picture, there's extravasations injuries. Many stories, many defeating stories, like 4 kids asking me, my mom told me if we have been attacked, we will be in heaven, and I hear a lot of chaos now. Am I in heaven? This is the heaven that my mom promised me. There was at the same time, as you deal with this casualty as a doctor, it will be like a heartbreaking for you, and it will affect your psychological impact. Unfortunately, you can see in this picture a father that I told, we have no equipment, we have no infrastructure to deal with the casualty that your kid had already, and he just started to sing for the kid and recite Quran until the kid passed away. This is another picture for me, just standing on one of our resource areas after told another dad that the kid or your son is having a couple of hours, and unfortunately we have no structure or no infrastructure to deal with this. The psychological support that was unavailable at all, either for staff or for survivors. So I was just telling the dad and move to the next, and that's it, which is a very horrible situation. At some point, I was the triaging officer when my neighborhood attacked, and I've triaged my my own family members and my friends. You need to deal with this triaging process as you have trained, but at the same time, you recognize the faces and you want to do something, but unfortunately, you can't. When we have been trained to deal with mass casualties, unfortunately, there was never ever a session to deal with pediatric traumas or mass casualties. I've told you that Shifa Hospital is the largest trauma center in Palestine, but we have never had a pediatric bed or pediatric equipment. We have never trained with pediatric anesthetic or dealing with pain management for pediatrics, because it was not something very common for us to have a mass casualties from these kind of age groups. And we need to work on protecting dignity and humanity for these patients who arrived, and we just started to write coding system on their bodies, not even on cards, which is, again, a very horrible situation. As a closing message, I can say, in Gaza, we lost names before we lost lives. Each child deserves to be remembered as more than a number or a coding system. Commitment to advocate to pediatric care and to humanitarian protection. Thank you so much.
You